Cardiovascular questions, let's go. I haven't reviewed this in a couple of months, so weeks rather. So in a child diagnosed with a ventricular septal defect, what is the primary hemodynamic consequence of the shunting? So left to right, increasing pulmonary blood flow. It's so amazing how you can just click it, know what it is. Which clinical finding is most specifically associated with the diagnosis of atrial during physical assessment? Harsh systolic murmur, machinery like murmur. I feel like it's harsh systolic murmur. So ASD typically is harsh systolic murmur, while machinery like murmur is for PDA. Okay. What is the primary rationale for prioritizing surgical patch closure of an atrial septal defect in female patients so that inig magkaburo sila, hindi sila magkaroon ng emboli, is risk of emboli forming future pregnancies. A newborn with a large ventricular septal defect is at significant risk for developing which of the following complications? I would say large, so right ventricular hypertrophic congestive heart failure. When reviewing an echocardiogram for a patient suspected of having atrial septal defect, which structural changes would confirm the diagnosis? Both right atrium and right ventricle, kasi atrial man. Which nursing diagnosis is most appropriate for a child with significant septal defect who exhibits poor weight gain and tires easily during feeding? Imbalanced nutrition. Correct medical management for a child with ventricular that does not close on its own. Indomethacin to stimulate the closure of the septum. Open heart surgery with a patch closer is used. Indomethacin is used as a patent but is not effective for closing septal heart hole. So, open heart surgery with patch closure jud ang atong mabuhat for VSD, while indomethacin is for patent ductus arteriosus. Close siya. So, in the context of acyanotic heart defects, what is the shunt direction for both atrial septal defect and ventricular septal defect? Shunt direction, left to right shunting, increasing pulmonary blood flow. A child with ventricular is undergoing diagnostic testing, which complication result from increased pulmonary blood flow would the nurse monitor for? Polycythemia due to chronic hypoxia, pulmonary hypertension. Cyanotic effects ng mga polycythemia where there is low oxygen, which is not primary state in a cyanotic. Pulmonary hypertension in for patient with atrial septal defect, cardiac catheterization can serve which of the following? Closing, repairing mitral valve, measuring heart diagnostic, closing of parotid duct and assessing leg cramps, diagnostic evaluation, and interventional repair. The source material identifies cardiac catheterization as both diagnostic and interventional for ASD. I don't know, I didn't remember cardiac catheterization as a thing, but it's for diagnostic and intervention. Which of the following assessment would the nurse most likely find in a child with small ventricular septal defect that is expected to close spontaneously? Murmur without significant symptoms like fatigue or poor feeding. In a pathophysiology of an atrial septal defect, which specific heart chamber is primarily overload due to the shunting of blood? Right atrium and right ventricle. The nurse is creating a plan of care for child with ventricular, which nursing demonstrates to the heart's inability to meet systemic metabolic demands. Plan of care for a child with ventricular septal defect, which nursing diagnosis relates to the heart's inability to meet systemic metabolic demands. Okay, decreased cardiac output. Which statement accurately compares the murmurs heard in VSD and ASD? VSD and ASD. Okay, VSD, murmur at birth, is only present in murmurs, no? ASD is associated with harsh systolic murmur, while VSD also presents with a murmur. Yeah. Which of the following is a shared clinical manifestation of both atrial? Failure to thrive, fatigue, and activity intolerance. Pathophysiology of left steatorrhea man is specific of cystic fibrosis. In the pathophysiology to right shunt, why is the patient typically cyanotic? Because the heart comes in by producing more blood cells. Is shunted from left heart back to the right heart of the lungs. Since oxygenated blood is simply recirculated through the lungs, the blood reaching the body remains oxygenated, preventing cyanosis. Ang imong oxygenated blood simply more recirculated sa lungs. The blood reaching the body remains oxygenated, preventing cyanosis. Sure siya sa lungs. Man ka ha. Kuya, asa naman ang kuan. An infant with ventricular septal defect is noted to have poor feeding. What is the most likely physiological cause of this observation? Ventricular increased metabolic demand, fatigue due to cardiac Which specific diagnostic finding would most clearly distinguish atrial echocardiography showing large with the right idiom? Echocardiogram based on the hole in the right atria, first chamber, whereas it usually bypassed VSD. Why would a nurse encourage respirators for child known with atrial septal defect to allow the log rolling procedure to manage the common nursing diagnosis activity? In ventricular septal defect, the blood flows from left to right. This occurs because pressure in the left ventricle is higher than the right. Yes. Munang masulod sa right. Okay. Kung sa left ba, sa whole body niya papunta. A patient with large ESD is risk of the nurse knows that the most common surgical method is surgical patch closure. Which of the following is not characteristic of a ventricular septal defect according to the research material? Machinery like murmur is sa patent doctor's arteriosis ng machinery like murmur, PDA. When atrial septal defect is left untreated, what long-term effects on pulmonary circulation is expelled? Atrial septal defect is left untreated, what long-term effect on pulmonary circulation is expected? Wala ni mo na treat ang ESD. Long-term pulmonary circulation is expected. What long-term effect on pulmonary circulation is expected? Atrial septal is left untreated. Increase pulmonary circulation. Okay, what's na akong mag-increase pulmonary circulation? Ako kagat. Based on the nursing data provided, which concern is most common to both ASD and VSD? What is the anatomical location of the defect and the atrial septal defect? Subclavian artery and ductus arteriosus. Sama na. Left and right atrial man. Which of the following interventions is most appropriate for a child with ventricular septal defect showing signs? Which of the following interventions is most appropriate for a child with ventricular showing signs of fatigue? It's most appropriate for a child, VSD. Small frequent feedings. Echocardium significant in the diagnosis such as visualized in the right atrium and right ventricle. Pressure difference between the upper and the lower limbs. Kind of enlargement of the right atrium and right ventricle. 24/27, not bad. Hello, so PDA is next. I forgot what this is, but it's a quick overview. Patent ductus arteriosus is like when it forgets to close when ang gawas ng bata, dapat first breath would close na ang ductus arteriosus. So, what is the primary direction of the abnormal blood flow shunt after birth? So, from pulmonary artery to aorta. From aorta to pulmonary artery. From pulmonary artery to aorta. Oh, what? Because systemic pressure is higher in the pulmonary pressure after birth, okay, blood shunts from high pressure aorta into the lower pressure pulmonary artery. So, systemic man is higher than pulmonary. Ang puadto ta sa aorta, pagawas, yan to siya sa pulmonary. Okay. High pressure to low pressure, na siya na principle from aorta to pulmonary artery. Which characteristic murmur is often indicates patent ductus machinery-like murmur. Continuous nature of blood flow between aorta, machinery-like. Which of the following pharmacological agents commonly expected to facilitate the closure of patent ductus arteriosus in post-term infant? Prostaglandin E. Indomethacin! Tama ka! This medication is used to keep the ductus open in specific cyanotic effects, which opposite of the treatment called for PDA. Kaya di mo na to siya ipa-open, ipa-close mo na to siya. So, prostaglandin E inhibitor is effective when stimulating constriction and evaluating closure of the ductus. Indomethacin is a prostaglandin inhibitor. When assessing a child with PDA, which blood pressure finding would the nurse most likely suspect? This is still cyanotic, so no. PDA. So, ina akong patent yung iyang ductus arteriosus. Lagi dito, nalagay siya padulong. Balik-balik, ragyapon siya. Wild pulse pressure. The run of blood from the aorta into the pulmonary artery during diastole lowers diastolic pressure. Okay. Okay, wide pulse pressure. Kagets na ko. Katuning systolic minus diastolic. So, the run of blood from the aorta to the pulmonary artery during diastole lowers the diastolic pressure, leading to a larger difference between systolic and diastolic readings. What is the compensatory that cardiac change occurs as a result of the increased pulmonary blood flow in the patent ductus arteriosus? Kay may tabo. Nara ni COD. Pulmonary artery pressure gonna decrease. Ngayon mo decrease man. Muda ko man di ba dapat siya? Hypertrophy na lang. Yes. Same lagi hapon. So blood, extra volume of blood returning from the lungs and increased pressure in the pulmonary artery circuit eventually force the right side of the heart to work harder. Which nursing is most appropriate for a child with a significant patent ductus arteriosus who tires easily during feedings? In fact, activity intolerance. Besides indomethacin, which other common over-the-counter medication can be used to close the patent of absciximab and siguro? No, because this is a platelet receptor inhibitor mentioned in the treatment for Kawasaki disease and for PDA. Platelet receptor inhibitor. So, indomethacin, ibuprofen is an NSAID drug that can use to inhibit prostaglandins and close the ductus. So, prostaglandins man daw is like relaxation, so dili siya mo force to close ba. Ibuprofen is NSAID, and then non-pharmacological, surgical, or interventional options are available for patent ductus arteriosus that fails to close with medication. What non-pharmacological, surgical, or interventional options are available for a patent ductus arteriosus that fails to close with medication? Balloon angioplasty. Blalock is a tetralogy man. Dili po arterial switch kaysa kuan man eh. Balloon angioplasty guro. Coils and balloon angioplasty is for coarctation. Tama ka. So, coils or ductal ligation, di mo ko kasabot unsay pasabot sa ligation, can be placed by a catheterization to occlude the ductus, or surgical ligation can be formed to tie it off. Okay. Coils or ductal. A nurse notes low diastolic blood pressure in neonate. How does this finding relate to pathophysiological patent ductus arteriosus? So, the narrowing of the aorta, blood flows out of the aorta into the pulmonary artery during diastole. In the context of cardiovascular disorders discussed, patent ductus arteriosus is classified as what type of defect? As cyanotic left to right shunt. Pressure, high pressure to low pressure, aorta to pulmonary. So I did 50/50, so that means I need to keep on learning this. Next question is, what is the primary anatomical characteristic of coarctation of aorta? Narrowing or do not shut of the lumen of the aorta. In a child diagnosed with coarctation of aorta, where would a nurse expect to find the highest blood pressure readings? Upper or lower? Upper blood pressure. The narrowing causes increased blood pressure in part of the aorta and branching vessels located above the constrictions. So, which pulse assessment finding is highly indicative correction? Weak radial pulse, irregular bounding pulse in the feet, weak femoral pulse. Femoral pulse is kinadapit femur. Really? How is preductal coarctation of the aorta specifically? Preductal is narrow course before the scopic ductus. Preductal versus postductal. Focus at the types of so between the subclavian artery and the ductus arteriosus. Preductal is the anatomical situation between the subclavian artery and the ductus arteriosus. Subclavian artery, ductus arteriosus. A patient with coarctation of aorta complains of frequent headaches and epistaxis. This physiological basis for these symptoms. Frequent headaches and epistaxis. Okay, a patient with complaints of frequent headaches. Okay. Okay, na kay frequent headaches. This is the physiological basis of the symptoms. Increased blood pressure in the upper body. Which of diagnosis is the most appropriate for a child with coarctation of aorta? Diagnosis, ineffective perfusion. Which non-surgical method is available to treat the narrowing of relaxing prostaglandin E? Balloon angioplasty. Well, keeps the ductus open, it does not fix actual. Okay, it's catheter and can dilate. This common musculoskeletal symptom reported by older children with coarctation of aorta due to lower blood body perfusion. Common musculoskeletal symptom reported by older children. Lower body perfusion. How muscles react when they do not receive enough oxygenated blood? So how do muscles react? What is the common muscle reported by the older children with CoA due to lower body distribution? Blue sclera. Lower body perfusion. Clubbing of the fingers like cramps, joint swelling in the knees. leg cramps. Yes, due to what is surgical procedure involves removing the narrowed portion. That's surgical resection and anastomosis of two healthy segments. Magilano din sa kasa arcation, no? Which finding during a physical exam would most likely suggest simple subtle defect in blood pressure between arms and legs. So, difference of blood pressure sa arms and legs, mo din na i-check twice. Tetralogy has only 5 questions. Thankfully, this is also something that I consider to be something that I'm an expert in, so thank you Lord for that. By the way, there are 3 things for cyanotic, atrial, and ventricular septal defect, patent ductus arteriosus, and corrugation of aorta. So, asa yun natin tira magdang baby. Kaya somehow napagya po oxygenated blood madto sa systemic circulation. So, nurse is reviewing the 4 anatomical components of the following: just ventricular pulmonary overriding rate and right ventricular hypertrophy. An infant with experiences death spells during crying. What is the prior to nursing action? Nietzsche's. Why does the body develop polycythemia, and what is a critical risk associated with this finding? So it is because of the shunting of blood from right to left. No, it is a compensatory response to chronic hypoxia, increasing the risk of blood clots due to high viscosity. Levels stimulate erythropoietin production to more red blood cells, thickens the blood, and promotes thrombus formation. Which statement describes the pathophysiology of blood flow in a child with tetralogy of Fallot? There's reversal. Blood flows from the aorta through aorta and pulmonary artery resulting to closed loop system. What? Blood shuns unoxygenated blood shuns right ventricular. Ano ko ibasa tanan no? Abi na ko katuning overyarding aorta. So, unoxygenated blood shuns right ventricular to mo na yung kuan bypassing the lungs. Pulmonary stenosis and ventricular septal defy pressure in the right ventricle forces the oxygenated blood to the left and out of the overriding aorta. A child has undergone Blalock for tetralogy of Fallot, which nursing instruction is specific to posterity for this patient. Taking blood pressure. Okay. Avoid taking blood pressure on starting IV lines in the arm of the affected site. Tama. Blalock shuns often involves subclavian artery, which can prevent circulation on to that one side, beginning unstable to BP. Because dehydration can increase blood viscosity, which is so dapat dili nato restrict ang fluids kay dili ta dapat dehydrated kung natay tetralogy of Fallot. Kay makakause siya og more blood viscosity, which again is something na atong ginalikayan sa tetralogy of Fallot because polycythemia bata produce og more erythromycin para makompensate sa hypoxia. So, yeah, mali siya daw. A pediatrician patient, what is the major criterion according to Jones criteria? Erythema marginatum. Mao pong gituplok zay. Okay, so I cannot accept that. Sakto po. When managing a child in the acute phase of what is the primary rationale for enforcing complete bed rest? So, to reduce workload on the heart to prevent further cardiac complications. So, kailangan CPR dahil nato ning mga rheumatic heart failure, no? Kaya, reduces myocardial oxygen demand, which is crucial when the endocardium and valves are inflamed. Munang carditis siya. So, rheumatic heart diseases and tetralogy of Fallot is cyanotic na sila. A patient with known allergy to penicillin requires treatment for complete group A beta hemolytic infection to prevent RHF, which alternative medication is used. Oxycillin ba to? Ibuprofen, gram positive cefuroxime. I know that these are ibuprofen na lang instead mo na azithromycin, abexicimab, erythromycin. Again, sa Kawasaki ng abscimab, which is a platelet receptor inhibitor for Kawasaki. Receptor inhibitor. Dili siya mo once a platelet, no mo let one work ang platelets. So, erythromycin serves as the standard alternative for antibiotic for patients who cannot tolerate penicillin due to hypersensitivity. Apim na kung ang erythromycin is a creator of the red blood cells. Lord, help me sa mga exams sa ASEAN next week. In the pathophysiology of rheumatic heart fever, what is the significance of the 1, 2, 3 week period following pharyngeal infection? Lord, help me, Ani, Lord God. Significance of the 1 to 3 week period following the pharyngeal infection? This is 1 to 3 week period following. It is a time required to migrate from the throat to the mitral valve, yeah. For autoimmune response to fibroid core. It represents the delay required for autoimmune response and fibrin deposition to occur. So, it's not a direct infection, but a delayed systemic inflammation response that manifests after the initial strep has been often resolved. So, kailangan na 1 to 3 weeks manggod magka-develop niya siya ani ba. So, under assessing a child suspected of having epiglottitis, which set of 3Ds findings would most strongly suggest this medical emergency? 3Ds for epiglottitis. Ano ba ito dire? Drooling dysphagia and dysphonia. Having, oh my gosh, wala ni siya nagmaong. Connect serves as an reference to meconium ileus, where thick meconium obstructs the small intestine, is a classic sign of cystic fibrosis, exocrine gland dysfunction. Which result would require repeat suspicious rather than diagnostic? Consider positive, so between 40 subordinate for suspicious assisting testing for confirmation. So a patient with PDA, what is the identification for the polycythemia? Gawin ako yung method to. Dramatic. Transplantation of great vessels. Worship overriding of aorta. What's the difference nila? Why is the presence of an associated effect like patent ductus arteriosus or adrenal septal effect necessary for survival in a newborn with a I don't even know nga kailangan dahil pa siya survive siya kung nasa transportation. So, this effect allows for the necessary mixing of oxygenation blood, allows to ventricle blood. Chance ensure that the right ventricle remains primary pump for oxygenated blood. Fittings are required to prevent immediate development of pulmonary hypertension. First are supplies. Next, allow for the necessary mixing of oxygenated blood. Okay. Kailangan di ay necessary for the mixing. Okay. Systematic blood cannot sustain that shunt to allow the oxygen to reach the body. Okay. So, a newborn with TGA is prostaglandin E. Why is it intended to protect medication? Systemic increased contractility. Pang-relaxants mo ka. Depende pa sa hepatitis. To facilitate blood mixing. Ano man, i-blood mix siya, kay naglahi magod sila, kuan-bakuanan. Ano siya i-blood mix para somehow na makuha. I think. So, according to the standard medical management firm, one should definitive arterial switch procedure to be performed after 1 week. So, one should dapat mag-perform ka. Within the first week, after the pressure from within the first week. So what type of surgery is that within 1 week siya? Which diagnostic finding expected during cardiac catheterization of an infant with transportation of great vessels? Significant elevated pressure in the left atrium compared to the right atrium. Cardiac catheterization, okay. Right sides. Low O2 saturation levels. Wala yung kawanan eh. Low O2 saturation levels. Cardiac confirms low systemic oxygen saturation because aorta is carrying deoxygenated blood from the right ventricle. What is the primary purpose of balloon atrial septostomy in a patient with DGV? Measure the pressure gradient across the pulmonary valve to rule out stenosis. Create an enlarged opening in the atrial septum to improve the mixing of oxygenated blood and deoxygenated blood. Okay, what is the primary purpose of a balloon arterial septostomy in a patient with DGV? Close ventricle septal defect that is causing excessive pulmonary blood flow. Primary purpose of balloon arches. To create an enlarged opening in the atrial septum to improve the mixing of blood. Okay, so kabalo na taas ito mas weak, no? Dire. To create an enlarged opening in the atrial septum to improve the mixing of oxygenated. Okay, so for balloon atrial septostomy, what mo ko remember doon yan eh. Which nursing certificates prioritize for child diagnosis? Which proportion? During echocardiogram with suspected TGV, what finding regarding heart size is typically noted in the source material? Enlarged heart, normal size with thickened pericardium. Enlarged heart. Which clinical sign is a hallmark assessment finding of a newborn with TGV? Bounding peripheral process. Cyanosis, of course, being pumped directly into the systemic virus circulation. Okay, deoxygenated na yung i-add sa systemic. And how is the relation between the pulmonary and systemic circulation described? Cannot reach it. There's no direct connection between the two systems. Okay. Oh my gosh. Sige lang. finishing up with Kawasaki. Thank you, Lord. So, baksak ko ha. Nurse is assessing a child with Kawasaki, which finding febrile state with the most strong support according to the clinical criteria. Fever lasting 5 days. What is the primary pathologic risk with vasculitis, including immune? Hypotension? Aneurysm? Yes. Aneurysm is the rupture of vessels. Treat patient diagnostic the most effective preventing cardiac complications. First 10 days day. Around sa may IVIG sa Kawasaki. In the medical management of Kawasaki disease, what is the specific dual rationale for prescribing aspirin? Acts as both anti-inflammatory and anti-platelet agent. Okay. Magkampol-kampol manggod diri sa Kawasaki. Kailangan di ka aspirin, no? Nursing interventions prioritized to monitor for the onset of congestive heart failure in the child with Kawasaki. Prioritize to monitor for the onset of congestive heart failure in the child with Kawasaki. Frequent auscultation for REALs and monitoring of tachycardia. REALs and an increased heart rate are clear early clinical indicators that the heart is struggling to pump effectively due to inflammation. The physician prescribed Abdixima for child disease. Okay. What is the platelet receptor inhibitor Abdiximab? When assessing the oral cavity of a patient with Kawasaki, which statement finding is characteristic of this condition? Cerebral cap lips. Okay, other terms for Kawasaki: mucolytic, lymphatic, Chervalo. Nursing diagnosis for Kawasaki includes risk for ineffective perfusion. What is the underlying cause of this risk in the context of specific disease? Thick tenacious mucus obstructing the small ducts of the exocrine glands. Potential for coronary artery aneurysms and inflammation. What is the for this risk for perfusion? Coronary artery aneurysms. Which comfort measures specifically recommend in the nursing interventions for a child with Kawasaki? Nutritional for cystic fibrosis, high calorie, high protein. Kani application of lip balm for preventive clothing. Which body part is typically affected by the lymphadenectomy condition? Cervical region. Okay, good night.